You're watching Cetome TV. Knowledge is power.
Do you think that Angelina Jolie did the right thing by getting a double mastectomy?
It's hard to say. We don't know what mutation she had. We don't know what co-mutation she had. I think she didn't, no.
He thinks it might have been a little extreme,
Yeah.
but we don't have all the data.
And, you know, it's not necessarily just the breast tissue. If you have a BRCA1 mutation, I mean, this is affecting all of your cells. It's not just your breast tissue.
This is true.
And just because you have it, you know, it's not going to reduce the likelihood of it appearing as a tumor somewhere else.
Mm-hmm.
So I think it was excessive. I think you need to really look at the molecular features of every tumor individually before you make those decisions. And we don't even know what type of BRCA mutation she had. She could have had a mutation that, you know, resulted in partial BRCA function. She could have had a missense or a stop codon mutation. And in those cases, the BRCA transcript is taken up and broken down by a process called nonsense mediated decay. So she would have no expression whatsoever. So there's you know, every mutation has to be looked at differently. They're not the same, and they have completely different functions. Where the mutation occurs, which exon, was it intron, was it exon, the type of mutation, you really have to look at all of those things.
So the answer, again, comes back to the genetics, which we don't have information about. We do know, obviously, her mom died of that form of cancer. She's also somebody, you know, as an individual who's a real innovator and leader, and that might have been part, just kind of personality, is to take those big leaps.
Well, you know, I think with the stars, a lot of the stars don't get that much better treatment. They can afford it, but for some reason, they don't get it.
Well, because there aren't that many people out there like you, I would say, is one of the main reasons.
we do have some stars calling us.
We do.
We have some pretty
totally
big hitters calling us.
That's right. And precision oncology is a brand new field, less than 10 years, because it really relied on genetic testing, which has really just come along, you know, in the last, well, less than 10 years, actually. Good question, Renee, though.
Thank you for watching Cetome TV. Subscribe below and stay informed.